Alcoholism is a substance addiction disease that runs rampant in communities around the world. Today we'll discuss the causes and impacts of alcoholism. Alcoholism is also widely referred to as alcohol dependence, wherein someone drinks so much over a prolonged period of time that their body becomes dependent on the substance in order to feel normal. Some alcoholics have said that alcoholism makes drinking feel like the single most important aspect of one's life. But what causes alcoholism? Is there any one identifiable cause? The answer is no, not really. Certain individuals who display addictive behaviors are more likely to become alcoholics, and that behavior is often passed on genetically to one's offspring. Some alcoholics have said that they started binge drinking as an escape or as a way to temporarily rid themselves of the struggles brought on by depression and anxiety disorders. It's crucial that people be educated about the symptoms of alcoholism in order to be able to tell if it's happening to themselves or someone close to them. Some risk factors of alcohol dependence include more than 15 drinks per week for men or more than 12 drinks per week for women, having a parent with alcohol dependence, or having a mental disorder like depression. Alcoholics tend to drink alone, have a high tolerance to alcohol, and are quick to become angry or hostile. Physical symptoms like lapses in memory and alcohol cravings are also common. Alcoholism is a bigger problem than many people think. In 2013, 24.6% of people over the age of 18 reported having engaged in binge drinking in the past month in the US alone. Nearly 88,000 people die each year from alcohol-related causes in the US, making it the third leading cause of preventable death. In 2006, alcohol misuse problems were responsible for costing the U.S. $223.5 billion. More than 10% of America's youth has had at least one parent with alcoholism. It's important to know the signs of alcoholism so that they can be recognized in yourself or your loved ones. To better understand how to identify the signs of alcoholism, watch this brief video from howcast.com.
How to detect the signs of alcoholism. Not all alcoholics fit the stereotype of the down-and-out drunk. Learn to recognize the warning signs in yourself or a loved one. You will need reflection, observation skills, and honesty. Step 1. Weigh the importance of alcohol to you or a loved one. Is there a general preoccupation with drinking, like when, where, and with whom the next round will begin? Is it difficult to stop drinking once it starts, or to stick to a limit? Is a life without drinking impossible to imagine? Step 2. Consider how much alcohol is consumed. Does drinking take place on a daily basis? Is binge drinking, more than 5 drinks in one sitting, a commonplace event? Do hangovers and blackouts occur frequently? The compulsion to finish every drink, and even other people's, is a red flag. Step 3. Examine the motives for drinking. Using alcohol as a mood enhancer or coping mechanism is common among alcoholics. Step 4. Think about the guilt, if any, associated with drinking. Have there been promises to cut down, lies told about the amount consumed, or about drinking altogether? Step 5. Measure tolerance for alcohol. Being able to consume a lot of liquor with few signs of intoxication is not a badge of honor. It's a sign of addiction. Step 6. Don't be fooled by the ability to hold down a job. As many as half of the 18 million American alcoholics are considered high-functioning, meaning they can spend years maintaining the facade of a normal life while drinking to excess until something catastrophic happens. Step 7. If you see these signs in yourself or a loved one, call the National Drug and Alcohol Treatment Referral Routing Service toll-free at 1-800-662-HELP. 4357 for help. Did you know? According to one study, 10% of the U.S. population's drinkers imbibe 50% of all alcohol consumed.
Luckily, it's not hopeless. There are many ways for alcoholics to get help. The goal of alcoholism treatment is to achieve abstinence from alcohol. Above 50% to 60% stay abstinent of alcohol after the end of 1 year's treatment. Resources like AA or Alcoholics Anonymous provide accessible support groups for struggling alcoholics. Further treatments include detoxification, often necessary in extreme cases wherein the alcoholic has dangerous amounts of alcohol in their bloodstream and must lower the toxicity level. However, the single most important step in recovery from for an alcoholic is maintaining sobriety. Thank you for watching this public service announcement. We hope that in the future you may be better equipped to deal with you or your loved ones having an alcohol addiction. Thank you.